So this is a pre-activity screening within the fitness assessment class. And so this is the first, before you do any type of assessment, this actually is an assessment, but this is a screening method to make sure that your clients stay safe and you protect yourself from liability. And we're going to be looking at the client intake form. We'll be looking at a Canadian document called the PARQ, and we'll look at the updated version of the ACSM risk stratification. So when we look here at the key objectives, we're looking at this health appraisal, and it serves as the basis as a backdrop for conversation when you're inquiring about health history. You want to stratify their individuals according to their disease risk. So people that are going to have a sudden heart attack or stroke, you want to make sure that these people are screened, and that you want to refer these people out in case sometimes you're your first contact with the healthcare system. The rationale for the pre-existing screening or for the pre-testing and screening is to really, we work from the bottom up here, is to help establish goals to progress towards. There's going to be people that say they want to come in and lose weight, and these are things they want to do, but there's going to inevitably be things that they're going to need to do, especially if it comes to like blood pressure and heart rate and other aspects there. Cardiovascular and musculoskeletal injuries are associated with exercise. You're forcing the body to do things it's not used to doing. The risks do increase with the intensity of the exercise. The risk also increase in those individuals with known or previous injuries or diseases, so previous heart attacks, previous strokes, high blood pressure, diabetes. Therefore, it is crucial to know the medical history of individuals and perform some level of screening before you start even the health-related aspect of fitness assessment. This is a summary of that previous slide. You want to identify those with medical contraindications, when to refer out, and it's really going to help you tease out these needs versus goals. And it's just some of the things that we gather in this pre-activity screening help us in our decision-making process with the program design and education. And this pre-activity screening is really part of the client acquisition process. When we look at personal training, everyone always looks here at the service end of things, like coming up with good workout, exercise programming, and motivation. But there are 5 things that need to happen, particularly this closing of the deal, before someone agrees to work with you. And it starts off as an initial meeting, either a chance or purposefully driven aspect or a referral from a previous client. You're going to have a conversation. You're going to take some data in, some intake, what they want to do, what they've done before. You're going to assess them. So you actually do a formal fitness assessment, including this pre-activity screening. You'll involve in some kind of consultation. So you'll present the results, the findings, and propose what needs to be done and what you can help with. Then there's an agreement from both parties that perceived value and determination to move forward. Then the service aspect. So there's a lot that happens to generate clients. And this is one of it's viewed upon as one of the negative aspects of, it's a sales job. Well, it's not a sales job. It's a service provision. You have to provide service, and you have to convince that person sitting across from you that you are the best person for that job. So it's like an interview. It gets easier as you have more and more referrals, as you have more and more case studies, and it's a process. So screening versus assessment. These terms are used a lot in the fitness industry, and there's lots of controversy over some of the tools. So some screening tools are used as an assessment, and these screening tools that are designed were never meant to be used for an assessment. Screening tools and assessment tools are different, and they differ in this aspect. All screening tools do is just identify an issue. It doesn't tell me what the issue is, doesn't give me any details. Is there a problem, or is there something that needs more attention? It's like the check engine light on your car. It's just a screen. It doesn't tell you what's wrong with your engine. You have to go in there and actually assess and find out the details. But the screening tool is more that red flag. It's an indicator. It's unclear what the nature or the details of the problem are. Whereas an assessment now is the actual confirmation of the actual issue or problem. So what we're doing now is just screening. We're looking for a red flag. Hey, you know what? Let's get that checked out just in case. And part of our toolkit here are these goals and needs assessment. So finding out what your client wants to do. These are all things that come up in conversation, but what's really nice, if you can get a client to write these things down before you actually meet, it gives them a time to actually come up with a meaningful conversation and think about it instead of just like pulling off the top of their head in that first meeting. A health history questionnaire, the HHQ, there's not a standardized document. If you've ever gone to a doctor's office or you've gone into a massage therapy clinic or you've done something with a service provision, they're going to ask you to fill out a document so you can write some things down to tell what's going on. So it almost acts as a scaffolding or a framework for the conversation to go. And then we're going to introduce these two instruments here. We're going to introduce the PARQ, the Physical Activity Readiness Questionnaire, which is actually a Canadian document that's been used for a long time. And we'll talk about the ACSM risk stratification. This has modified. It's more like the PARQ now, but both of these aspects are the screening tools you'll use. But honestly, these are the two areas where you're going to get the most value from your aspect. These are just screening tools to say, hey, you're okay, cover your butt, let's move on, or hey, why don't you go see your doc? These are the ones where you're going to, depending upon how they're crafted and written, it's going to give you the most amount of meat and substance to actually discuss with your clients or future clients about. So the health history questionnaire, like I said, it varies from venue to venue. These are basic conversations. It looks like this, right? Like mark an X where you have stabbing pain, or where do you have like the urge to urinate, or whatever weird stuff you got going on, your symptoms. I'll ask you about your musculoskeletal, some family history. So that's basic stuff. The PARQ, the Physical Activity Readiness Questionnaire, like I said, it's a Canadian document, but it's a really powerful document. It's a really good screening tool, and it's 7 questions, and it's common sense as your best guide to answer these. And the documents here, nice and colorful, and it's a very user-friendly document. In the Blackboard shell, there's a demo of the 2020 PARQ Plus, which is a little bit more involved, but you can kind of play through it a little bit. But these are the 7 questions that they're asking you. So if you look at any of these questions, you realize that these are just more common sense type aspect, like, hey, your doctor says you have high blood pressure and you're not taking your medication, or you have a good physical reason why. It's just precautionary, getting people to think, and it's really more of just a pause and say, hey, look, I know you're really excited about working out. I'm glad you're so excited, but maybe you didn't realize that this can put physical stress on the body, and that if there's a weak link somewhere, we're going to find it. Not that that's my intention, but that's what might happen. And increased blood pressure, increased heart rate, increased stress, stamina. If there's an underlying problem, it's going to surface. So if a person answers yes to any of those questions, you kind of put things on pause, red flag, and it's advised to see their physician. Now they don't have to. It's not a contract, or you're not going to go to jail over it. But if you were a relatively have integrity, you're going to operate, because if you did this document and something does happen, you might be liable, especially in our day and age today. The PARQ was considered not effective enough. It didn't go into detail. It didn't stratify. So in 1988, the American College of Sports Medicine and the American Heart Association published a little bit more complex, and it was a risk stratification. And up until 2015, even up until a year ago, I was teaching this aspect. And in 2017, 2 years ago, the problem with the ACSM risk stratification is that it was too sensitive of a tool, meaning that anyone over the age of 40, 95% of the people were halted in their exercise aspect, and they needed to see a doctor before they needed clearance. So it almost became a barrier, and unnecessarily so, because even though 95% needed to go see the doctor, the majority of them were cleared and were just fine. So the next few slides just shows you the artifacts of the risk stratification and the complexity. It says slightly more complex, but it was actually a pretty complex tool, especially when you compare it to the PARQ of just a 7-question survey. So this involved these domains of risk strata, these criteria, and you had to go through their health history, see what their issues were, and then based on this, tally up their total risk for a cardiovascular or metabolic event. Okay. And then based on their amount of risk factors, you would stratify them into low risk, moderate risk, and high risk. And then based on their risk, they would tell them that you'd either have to have a doctor's clearance. So it was kind of a beast. So we really don't have to do it anymore. So good riddance, kind of. Part of the test, which still remains today, is being familiar with these signs or symptoms. These are horrible slides. I just wanted to post these up here. Both of these images are on the Blackboard shell. They're in your textbook. But they basically go through the 7 or 8 major signs or symptoms of cardiovascular, pulmonary, metabolic, or renal disease. And these are the things that you want to be aware of. And they're as simple as you have chest pain with activity, you have shortness of breath with activity, you have unknown swelling, you have unusual fatigue. So these are things that most people, if they spent the time to think about it, would probably go and see a physician for anyway. So it's not like some odd aspect. Some of them are weird, like not weird, but not common, like the orthopnea, like this feeling of shortness of breath when you lay down, right? And that's a sign of like maybe some pulmonary fluid or congestive heart failure, dizziness, lightheadedness, your syncope, you're passing out and you don't know why, right? These are just things that if you would be like, oh, maybe I should see a doctor about that. So the way this works now is when you look at the document that I'm going to show next, it's kind of like the PARQ. This is where instead of having all those charts and everything, you kind of have this flow chart. And I have this document on the Blackboard shell for you. And I'm actually going to progress to the next slide. I'm going to show you the signs or symptoms. And then I'll exit out of the slideshow and I will pull up the document to go through that. But what you can see here is you get the pain, discomfort. These are the 9 signs or symptoms. So ankylodemia, shortness of breath, palpitations or tachycardia. So if you have like a rapid heart rate or runaway heartbeat. Intermittent claudation is usually in the lower extremities. It's like pain or cramping when you're walking, and not just like a Charlie horse, but like a continual progressive pain. And that's usually leads to, instead of coronary artery disease, peripheral vascular disease, where the peripheral arteries are becoming clogged. So a known heart murmur or any diagnosed condition that relates to this. So this is the worksheet kind of blown up a little bit, and it starts with the first question: does the individual currently exercise regularly? And this is brand new because they've been working out already and there's been no events. So they've been working out. Maybe you continue with it, right? And it's all dose dependent. So high intensity exercise is going to have a different physiological effect than moderate or low. But let's say for this particular example that the people are operating and they have not been working out. And so then the first question is, any signs or symptoms of those 7 things that I just mentioned? Yes. Okay. You need medical clearance. No. Progress with gradual progression, right? So it's a much easier chart to navigate. And the only thing that's required of you is to become familiar with, I'll back up a slide, with these 9 things of signs or symptoms of metabolic or cardiovascular disorder. So that's the simplified version. So it's really good. So that's what the take-home lab, or the lab you'll be working on your own, is basically 6 case studies. And instead of going through all those risk criteria, you're going to use this flow sheet to determine if they are able to go through exercise, and if so, what level intensity. And if not, what were the signs or symptoms that triggered your red flag? The ACSM partner with the American Medical Association, and they have Exercise as Medicine. And they have a worksheet, which is also on the Blackboard shell under the Lab 1 folder. And you have these signs or symptoms, right? And you can have like step 1. And it's kind of like the PARQ. You go through, and if you answer yes to any of the questions, stop, pause, red flag, and refer out to a physician. So our last slide here, we'll just do a couple examples. And if you read through here, it's going to give you a lot of this data. I'll give you the age, the sex, the BMI, and we're not there yet, but the BMI of 30 and over is considered obese, which is a risk factor. So fine. Drinks alcohol, but alcohol is not part of that. Moderately active, so she's not sedentary. Lipid levels are normal, and she does not have any signs or symptoms of cardiovascular disease. So would you send her out for a referral? And since there are no signs and relatively young and healthy, I would not. I would probably participate with moderate, start there and progress from there. Here, a 36-year-old non-smoker, another female, BMI, so on the lower end, heart rate, blood pressure, normal. She is a type 1 diabetic, right? So that's a metabolic disorder. Works 45 minutes. No reports of cardiovascular disease. I would probably, since it's a type 1 diabetes, it's not a lifestyle, it's a genetic aspect, I would probably say this is a no referral, right? Start with moderate exercise. And then number 3, 47-year-old. Now, if this person had a history of a heart attack or had a stroke, well, I would probably be a little bit different tune. Or type 2 diabetes, it might be. But remember, it's not the metabolic aspect was before. It is known cardiovascular, pulmonary, or renal disease. So any of those ankle swelling aspects. And then number 3, 47-year-old agent, inactive, family history. Let's see, BMI is 27, so still, but he has a high waist. So he's taking medication for blood pressure and has high cholesterol. So blood pressure is a cardiovascular disease. It's diagnosable. It's given medication. Although he doesn't have any particular signs or symptoms, but he has a medical condition of such, I would probably refer him out. So again, these are just guidelines, and if you want to caution on the side of being more conservative, then you can refer out, and it's going to come down to clinical judgment. When we look back at that slide here, it gives you quite a bit of wiggle room of like, okay, well, any of these issues here, no. And this worksheet kind of takes you through that a little bit more. So that's really what you're going to be doing for the first lab. Under the Blackboard folder, you'll have one file that has 6 case studies, and you'll be going through and noting any kind of issues that may be there, and then would you refer out or not.